anus would get very sore. Every day I'd have to put Vaseline around the opening.
Is it a herbal thing?
Herbal, yeah.
What, to increase your libido or your erections?
Erection, yeah.
Okay, and where did you get it from?
On the internet.
When you self-harm, is that cutting?
I get really, really bummed out sometimes. Just everything's all doom and gloomy.
So you've lost 0.2 kilograms. So do you think it's a great success?
Yeah.
A great success?
Yes.
Honest?
Yes, doctor. I think so.
I've got months to live.
Is that what they've said?
No more treatment, they're giving up on me. And they say how much time I go.
Good morning, Putney Mead, how can I help?
Should I book you in for Wednesday the 5th?
When?
Wednesday the 5th of November?
For today? Don't have anything left for today, unfortunately.
Sorry, Wednesday the 5th.
I don't know how...
Wednesday.
It's with Dr. Diman. Yeah, it's a lady.
Mr. Libby.
Hello.
Hans, have a seat.
Yes. Oh.
Right, 6 months since I saw you last.
Was it? Is it 6
It
months?
is.
Yeah.
What's the problem?
Well, it's various things. I've been since August feeling really tired. You know, I wake up exhausted and I keep getting, sweats and heart palpitations. But I think the most embarrassing thing has been I have had very loose bowel movement, not diarrhea in the last 3 months, but it's comes out like little worms, and I never feel I'm getting rid of it all. And sometimes, very embarrassingly, I've messed up my pants, from farting and burping.
Your bowels have played up in the past, haven't they?
They've played up in the past, and this is slightly different in that before I used to get the runs and sweaty. Yes, my anus would get very sore. Every day I'd have to, I do have to clean it now, but it's not the soreness where I have to put Vaseline around the opening, before I go to bed. So, yes, there has been problems with my bowels.
Okay, Hans, just pull that up. Okay, so if you pop up on there.
Yeah.
So pull it up.
Yes.
And undo your waist.
Yeah.
And through your mouth, a deep breath. Right. Good. And this one. Good. Okay, fine. And relax.
You did examine me, through the rectum, and I think you said my kidneys were okay. You were feeling them.
Yeah, prostate, I think, probably.
Oh, was it the prostate?
Yeah. You gotta have long fingers to feel your kidneys that way.
Sometimes it's a bit overwhelming just to have to see people and act normal.
My muscles were twitching and stuff, but I think partly it's to do with the sort of stress or anxiety and it playing out.
Yeah, trying to plan your life is absolutely rubbish.
I'm still feeling like I'm in one of those teacup rides.
I try to ignore it and say that everything's going to be okay, but I do get scared.
But don't be too hard on yourself. You've come a long way.
Come in. Hello. Come in. Hi, have a seat. Excuse me. So,
Hi.
How are things?
Yeah, they're okay. They've been a bit bad recently, but
Bad in what way?
Just mood and stuff has been really low, and finding it hard to have motivation to do things, and also been binging quite a lot. So yeah.
Is there any reason why that you can think of?
I think it's probably because I wasn't on my pills. I didn't know how long it was for, but I wasn't taking any for that period.
Did you just run out, or did you choose to stop?
I ran out and I couldn't afford it again.
Yeah. Okay. And when you were on the fluoxetine, how were your symptoms then?
Sometimes there'd be like bad days anyway, but I think I certainly wouldn't get into like anywhere near as black a mood. Like I get really, really bummed out sometimes. Just everything's all doom and gloomy.
It's very difficult when you're speaking to people about problems like this not to take some of it home with you. That's a very important aspect of general practice training, to ensure that that doesn't become too much of an issue in our lives. Alan Bennett said that you had to maintain a scrupulous and vigilant humanity. And in my work, that's something that I always try and remember and try and work towards. And in terms of the binging at the moment, what's going on with that? How much are you doing?
Well, I think it's happening on most days of the week. Only about once or twice if it's a particularly bad day. But trying to get on top of that is a bit hard, though.
Yeah, it's very difficult. What about your menstrual cycle?
No word yet.
Really?
Yeah.
No, since when?
Since, I think, when I first came to you, like 2 years ago, yeah.
Understandable. What about laxative use or anything like that?
Yeah, I'm still using those. I know I shouldn't be, but...
Right, and how often do you use those?
Every day.
Do you? Okay.
Constipated? Or?
Yes, both.
Yeah,
both. I have both. Yes.
She's going to toilet perhaps 6-7 times in the morning and in the afternoon, and then again during the night.
Gosh. I still have a really bad stomach. Everything I kind of eat still.
It's coming straight through.
Yeah.
Is there any blood when you go?
Sometimes, yeah.
And is it loose?
It's more mucousy.
Okay.
Are you passing a lot of gas? Okay.
I can't go out unless I know where there's a loo.
Yeah.
You know, it just winds me up.
So has there been any blood in your diarrhea? Or the looseness, really,
Well,
that you described?
I did wander once, and I was with a friend. We were on a walk, and suddenly I had to, this was in the country, and luckily I had to take my trousers down, and I don't think it was blood, but it was a vermilion colour, the feces, and it was wet, and that's happened about 3 times, where on country walks, I suppose. In fact, it happened last Saturday, where I had to go and quickly hide in this woodland whilst luckily, now what I do, I have toilet paper with me to...
Very sensible. Okay, your blood pressure is okay.
Oh, that's good.
I think we need to start off with making sure there aren't any abnormalities on a raft of blood tests. And I want you to come back and see me in 2 weeks' time.
2 weeks, yes. Yeah, I'm sorry to have all these symptoms.
Well, there's certainly a fair bit to get to the bottom of.
That's a bit of a pun, isn't it?
Could be.
Yeah.
But I'll see you in 2 weeks' time.
Okay, thank you, Dr.
Very good.
Mackenzie.
What's going on in life at the moment? You're still studying, is that right?
Yeah, just doing my dissertation, and then I'm still at work part-time as well.
Okay. And how are those things going?
Yeah, they're okay. Sometimes struggling to go into university a bit. Yeah, that was like 2 weeks where I just didn't go in, which is bad because I've only just started the year, but...
Okay, and what do you do when you like that?
I stay in bed all day, and sometimes I self-harm a bit, but yeah.
Yeah. When you self-harm, is that cutting? And any thoughts of trying to do more than
thoughts, but I don't think I'd act on them.
So in terms of today, was it to restart your medication? Or?
I think that would be good.
Yeah, it sounds like it'd be a useful thing for you. Fine, I think we got a letter from the Eating Disorders Service that said that you've been referred for an assessment for your suitability for something called dialectical behavioural therapy. So you're seeing there tomorrow?
Yes.
Yeah. Can we have a chat in about 2 weeks' time?
Okay.
We'll have a chat about what it is they're offering and sort of what support you've got, and we can then decide to go from there. Okay.
Good morning, Putney Mead. Rachel speaking.
Say ah.
Just look up for me.
Ah.
No. Can't really get to see your tonsils.
I mean, I took a phlegm sample. There's a bit of blood in it as well.
Yeah, I don't think I need that sample somehow.
Hi, Onda. Come in. How are you? Sorry to keep you waiting.
You were always late.
I know. I'm so sorry. Come and have a seat.
I haven't got better now, so I've been really ill.
Because you saw Dr. Andrews, didn't she, because of your chest?
My chest has been unbearable.
Because you were on some antibiotics initially, were you, or not?
Well, they prescribed them.
Yeah.
And I didn't take them because I thought I don't want to mix the antibiotics and the pump. Because I was taking the pump as well because my chest was really bad.
And have you had any temperatures?
I was getting hot. I thought, do you know what I mean? So what's been happening, Dr. Wallace?
Sounds like it. Let's pop this in here. Okay, so your temperature's all right.
Yeah.
You take your jacket off and we'll have a good
I still
listen.
got a bit of the cough, but not. Because I'm going away on Sunday.
Are you going to Blackpool?
It's Sunday, because it's my birthday on Sunday.
Oh, lovely.
So
you want to get well for that?
Yeah, so I don't want to be ill, Dr. Wallace, do you know what I mean?
Do you want to lift your shirt up so I can have a good listen? Big breath. And just sit forwards. Again. Chest sounds all right, actually. I can't hear any wheezes today.
Can I check my weight while I'm here?
Yeah, no, of course.
Because I think I've got on my... everything's gone pear-shaped at the moment.
On you go. Well, only 1/2 kilo, so it's not terrible.
Well,
but, yeah, we do want it to go the other way, but...
But to tell you the truth, Dr. Wallace, I'm trying to do it myself before going to Slimming World.
I think you should go to Slimming World. What's putting you off?
I've lost the form.
You've lost the form?
Yeah.
Do you need another one from Laura?
Not being... I haven't done it deliberately.
No, it's fine. I'll speak to Laura and I'll get her to sort out another one for you, because I think it is important to have the kind of support of Slimming World.
Also, I've cut down on my drinking.
Good, because that's empty calories.
But I haven't drunk for 2 weeks.
Good.
But I'm going to have a little drink next week. That's... because I'm away, so you do, don't you?
No, definitely. It's got to be a combination of diet and exercise.
I mean, my diet is quite good, really.
Good morning. Sorry, I don't know where I'm going in the afternoon.
I've got some pecans, a valuable source of protein and amino acids.
You can.
Oh, God, I've got a bit of old cake in there. Jesus. There we go. Come and have a seat. What are we doing?
Strange comment. One is, I feel like something's growing inside me, but I just wondered your comments. But the other thing is, I notice in the mornings my skin's tingly.
So tell me about this thing growing inside you.
Oh no, it's probably just I'm just overeating. But it just.
Do you think
feels
you've put
like a
on
massive,
weight?
Yeah, I've got a massive gut, which I didn't used to have.
And how much weight do you think you've put on?
Oh, I know. I weigh 14 stone,
Okay.
but I haven't been exercising for a year.
Why's that?
Lots of things happened in business, and I didn't have the stomach for it. Pardon me. Yeah.
Your eyes look a bit sore.
Oh no, that's out for a birthday dinner last night.
Oh, sorry.
Yeah.
So how much are you drinking, do you think?
Oh, at least a bottle a day of wine.
So more than you did?
I don't know what I said last time. We all lie, don't we?
I don't know. You know whether you lie or not.
Well, it's about the same, really. Yeah.
So you drink at lunchtime?
Yeah, I like lunches. So lunchtime and always in the evening, anyway.
Yeah.
Yeah.
Should we feel your tummy? I think that we need to do that. So slip your thing off. So maybe we should just do a whole load of bloods again and just check on everything.
That's fine. Just sit down.
Yeah, just lie down.
Lie down. Okay.
Come in. Hi there, hi. Have a seat. Yeah, good, good. How are you?
Yeah, so I actually wanted to see if I could get some amphetamines because I'm from the US and I did have a scanned copy of my prescription.
Right.
And the doctor had posted my prescription online, so would that be sufficient enough?
I wouldn't necessarily be happy to prescribe sort of amphetamines just based on the prescription from the US. Would you just explain a little bit more about what the prescription is for? And
it's my ADD, as well as I've been having difficulty concentrating. I'm going for a master's right now, and I guess I've been doing without them, and it's not good.
Right, okay.
Yeah.
In the UK, it's not often that we get people requesting drugs like amphetamines. But I think in America, it's much more readily available, so people can be prescribed medication like amphetamines for exams because they're labelled sort of smart drugs. But within the UK, those have been restricted in terms of prescription. Do you feel that at the moment you need to use other sort of drugs or alcohol at all to help manage the stress, or...?
I did smoke a spliff once, but that did help, but that's not advised.
And how does that affect you mentally?
Makes me focus.
Right.
Yeah, I can get work
done. It helps, does it?
It does.
You sure?
Positive.
Right. And, I mean, do you feel depressed or... Right. It sounds like there's a couple of things, and I'm just wondering what the best way you think of us helping you with that.
I don't know, it's hard to say. I mean, if I could really get those amphetamines, I mean, I almost... I almost cried myself to sleep last night.
In the UK, in terms of prescription of that type of medication for ADHD or ADD, then it's usually specialist prescribed, certainly initially. So what we'd want you to do is see a specialist and for them to confirm that that would be helpful for you. In the meantime, I mean, the other things that we can offer would be some help, some psychological support, help with stress management and that sort of thing. I mean, is that something that you've had before that you'd be interested in?
To be honest, like I'm just, I don't know. I guess like if I did get like a pamphlet or something in regards to it, I'd think about it.
Okay. Often problems are very complex and there are a number of different things that we as doctors can help with, but ultimately the patient is responsible for what they then do with that advice. That can be quite challenging as a doctor to change that mindset, to enable patients to take some responsibility for helping themselves.
Okay, what's the problem today?
All right, I took the medicine for losing weight, and it's finished.
Okay, if you take your jacket off, we better see if there's any evidence that...
Yeah, I hope so.
Okay, where you go. On your pop. Okay, 123.8. Right, so the last weight we did on you was 5 months ago, and you were 124. So you've lost 0.2 kilograms. So do you think it's a great success?
Yeah.
A great success?
Yes.
Honest?
Yes, doctor.
Right.
I think so.
Okay, well let me...
a bit lighter,
So with Orlistat, there are some fairly strict guidelines for us to prescribe it.
Okay.
So continue treatment beyond 3 months only if weight loss since the start of treatment exceeds 5%.
Yeah.
I'm trying to lose weight and it's just not really working.
Okay. I'm going to just wait until it goes 0, 0. There we go.
Okay. So how much weight do you think you've put on?
I'd probably say a stone.
So you've put on 2 pounds.
Oh dear.
Okay.
The body mass index doesn't come up very well with me.
Yeah,
Which basically doesn't take into account my build.
You probably haven't pushed yourself as much with regards to the exercise.
To be honest, when I get out of work, the last thing I want to do is go work out.
I leave the house at 7, and by the time you come back...
The motivation is...
Yeah, I know.
I want to go yoga.
Oh, yes.
Which is very good.
Yes, very good.
The trouble is, I don't know, I shouldn't say, but it's so grim.
What we're trying to manage with it is preventing things from happening in the future, like heart attacks and strokes.
We're not all sporty, but actually having a think, what you might enjoy from an exercise point of view is worth it.
And you were referred to the dietitian.
Yeah.
Is that happening? Still?
Yeah.
Changes?
Yeah, I changed my diet. But because of my knee, I can't do much exercise. The physio told me I should stop.
Yeah, but obviously your knee was stopping exercise, but the orlistat was stopped because you'd not been meeting the weight loss target. You know, their role is to help you with your diet and weight loss and exercise and performance. If they think that they're not succeeding and that we need to do something else, they might recommend to us that we prescribe something like orlistat. The reality, though, is that having had it, it's not really achieved the targets that the NHS dictate to me as a justification for carrying on that prescription. Okay?
All right, can I have a painkiller?
You can have a painkiller.
So was it a good party last night?
Yeah, it was. Yeah.
Okay, up you get. Put your things on. Let's just check on stuff, and then we can see you back with the results. Tummy feels fine. Right. I can't feel anything there that's
just slack.
A bit of slack. I mean, if you can manage to get back to your exercise regime, you're going to feel so much better because you always do, don't you? Yeah. Take that, and then you book an appointment for a blood test with the healthcare assistants. Fantastic. And we'll see you afterwards.
Thank you very much.
Okay.
Have a good weekend.
Yes, I hope so, and you. Not too good.
I've got this kind of freckle thing here, which I don't think I had when I was little.
Has it changed at all?
No, it just gets a bit more crispier because I just picked a bit off.
You don't pick and squeeze things.
Squeeze it all the time.
I've got a spot on the end of my nose. And I look at it every morning.
Last Monday, my hand started peeling and all the skin came off.
Pretty classic for something called seborrheic dermatitis, which is triggered by yeasts.
Yes, it feels very much like eczema.
Yes, I get it on my face, on my torso, my legs.
Okay.
How can I help today? My psoriasis has suddenly flared up. Over the weekend on my hands and my feet.
Do you mean psoriasis or do you mean eczema?
Well, I was told it was psoriasis last year, but I don't know whether it is or not.
It certainly looks like eczema to me.
Oh, right.
And we haven't got you coded as having psoriasis, but I can check.
With a P, psoriasis.
Yeah, it's a silent one. That's why we call it psoriasis. So tell me about when this came on.
Well, it literally came out like late Friday night, Saturday morning.
Okay.
And it's the same on my feet. You can see where all the little blisters are starting to pop.
It's quite interesting how your skin blisters.
And then they all pop. I mean, all of my feet, it all pops open, and then.
What do you normally put on it?
Well, I've been using Chinese herbs on it, which I bought with me.
Okay.
Because I find steroid cream makes it flare up, and then all the skin splits.
Okay.
So
Chinese cream often is made of steroids.
Oh, is it?
Yeah.
Because I find this doesn't work. Those are pills, and then they gave me this. Problem is, it's written in Chinese.
So I mean, I have no idea how safe this is or anything, but there is a lot of people that say that one of the reasons why Chinese medicine is so effective is it's got a whacking dose of steroids.
Oh, really?
Yeah.
I didn't know that.
But not monitored.
Of course,
and so not safe from that point of view.
And it would be in the pills as well?
It could be.
Okay.
So I can't recommend them, obviously just because we don't know what there's in them.
No.
There have been case reports of these medications containing dangerous levels of mercury, arsenic and lead. There was a big case last year, showed that they even contain parts of endangered animals. And although they're sold as being natural, that doesn't necessarily mean that they're safe.
Now, your liver function isn't entirely normal. Are you on any medications at all?
No.
Anything herbal or anything over the counter? Any supplements or anything that you're taking?
Yes, I did take, yeah.
What's that?
That's the it's a natural stuff for it's a sexual thing.
Okay, so it's a herbal thing?
Herbal, yeah.
What, to increase your libido or your erections?
Erection, yeah.
Okay, and where did you get it from?
On the internet.
Okay, I would stop that, because do you actually know what's in it?
No.
Let's stop it just in case, because some funny herbal stuff can make your liver test go off.
Okay.
Some medication that's being sold as alternative or natural contains the same ingredients as pharmaceutical medicines. So one example is a herbal remedy that you can take for erectile dysfunction, which was found to contain sildenafil or Viagra, which is a medication that has lots of side effects and can be dangerous if it's not prescribed under the right conditions.
I actually tried one of those Chinese places along the road, and I'm not sure if that made it worse.
What kinds of things did they try?
She was thumping it.
Right. Okay.
And then asking me to like chanting, all that kind of stuff, like fake. I don't think it was.
So probably at the moment, I'm not sure if chanting is going to sort out your neck.
Good morning, Putney Mead. Naomi speaking. Hello? This is Putney Mead. How can I help? Putney Mead.
So how are we today?
Pardon?
How are you today?
Yes, how can I help? How can I help?
Thank you very much. I am not bad.
Not bad, okay.
Dr. Smith? Dr. Smith?
Oh.
That's sore?
Yeah, very sore.
She won't be able to phone you because she's in a clinic. She's in clinic today.
There's a little bit of normal wax in there, but nothing that's causing deafness.
All right, take care. Bye-bye. 100 years old. That's crazy.
Hello there. Come through. Sorry to keep you waiting so long. Come in. Come and have a seat. So how are things with you?
Not so good.
No?
It's a day, so-and-so other day, you know, down the weather.
Yeah.
And I go months to leave it.
Is that what they've said?
They say, you know, anything they do make it worse. Now it's come out from the lung, it's my organ. So no more treatment, they're giving up on me. Okay. I'm planning to go in Italy Thursday.
Are you going back to Italy to sort things out, or what's going on there?
Well, I've got a nice flat there.
Okay.
And then give something to the friend, cancel all of the banking and all sort of thing, you know. Now, do you think I need something on the plane? Because the plane is pressurized. And with my breathing.
Yes, that's what I wonder. Let's check your oxygen levels.
Okay. The arthritis attacked me in my shoulder, my neck.
Just relax your hand down. There we go.
I'm disintegrate.
But you're still smiling.
Yeah, no, I keep smiling. People say nothing wrong with you.
No.
Oh, my favourite. I'm very fond of raspberry jam.
We know on the X-ray there's a little bit of wear and tear in your spine.
About 3 weeks now, I've had pain all down my leg, and I was worried maybe it was my hip.
Obviously, I overdid it because I think I'm 20 and I'm not.
I'm afraid that's fairly consistent with being 83 years of age.
It's no fun getting old.
Yeah, I know. People say.
Did you ever have TB when you were younger?
No.
Never. And just remind me, you were a smoker for quite a while.
Yeah, and not only that, the job I'd done, but that's the coaling and...
What job did you do?
As a coalman.
Right.
You know,
okay.
you're too young to remember.
No, I am, but I know what they were.
Coal on your back, you know. I mean, I'd done that for 25 years. I carried thousands of tons of coal.
Yeah.
But there again, that's the job you had to do, wasn't it? You know, you either did them or somebody had to do them anyway.
I think what you're going through is related to all that.
I do honestly. I can't think of anything else really.
No,
you know.
No. Do you bring up much phlegm?
Yeah, it's all clear. It is clear though, but it catches in the night, and I've got such a dry mouth.
Really?
It's dry, absolutely dry. I have to drop of water, like a bottle of water. I don't have a glass of water.
Right.
Don't ever have a glass of water in your bedroom. I'll tell you why, because I always went with a glass of water in a bedroom, and I never turned the light on. I just picked it up and had a sip. And one night I just turned it on, and there was a nice big spider having his early morning dips going round in it. Oh, God. I'll never again. But anyway, I digest as usual.
I can't do it. It's quite hard. I mean, my granddad's Scottish. My granddad is Scotland. There's a wee chance of that. Someone classed me as Japanese once. What? I know. I went, are you serious? She was like, you got that Oriental look about you. I was like, no.
So deep breaths. Okay. Let's have a listen at the front now. Good. That's fine. Has anyone ever talked to you about what we would call what's called a chronic lung disease? Has anyone ever talked to you about lung problems that you might have had that have been there for quite a while?
Well, I've always known I've had a bit of
that scarring.
Bit of a chest, like, you know.
Okay. What I was thinking when I saw you last time and what they saw signs of on the X-ray is something that we call COPD. Basically, as I say, it's long-standing damage to the lungs.
I can imagine that.
Yeah. What we need to do is do another investigation into it, which is a blowing test to give us a firmer idea. But no, if it's what it all points to.
Yeah.
It's not something that we can cure,
but
that doesn't mean we can't improve it. So, the test I want you to do is something called spirometry.
Oh, yeah.
Once you've had this done, what we'll do is start you on some regular inhalers, which I think will help a lot.
I feel better already.
Big breath and then breathe out as hard and as fast as you can. That's it. But short and sharp, not quite so long. So really try and... But better. Do it stronger than that. Really try and blow the end off. I think that's best you got, wasn't it? OK, you ever sit down.
Okay.
Let's have a little look at your things here.
I tuck myself in.
OK. Do you want a hand? Are you OK? Do you take any regular inhalers or not?
No, not regular.
I wonder whether it might help, because, I mean, there's a little bit of a wheeze there, but should we give it a go?
Yeah, okay.
What I want to do as well is talk to the chest clinic, who know you very well, and just get their advice about how safe it is for you to fly, the risk of the cabin pressures and things like that, and whether, if they think it is safe for you to fly, whether you need to have oxygen on the flight. I mean, obviously, having lung cancer, it is going to make flying dangerous, because we know you've got a lesion in one of the big airways, and the risk is that could obstruct and make your breathing substantially worse. The other thing is, when you've got cancers, it does increase the risk of you having blood clots in the legs and the lungs. So I would recommend getting some flight socks for when you go on to the flight. Don't drink any alcohol, and just try and keep your no alcohol, because that dehydrates you and it increases the risk of you having blood clots.
No, I got to go there. Maybe because they say the hospital, go as soon as possible.
And I mean, obviously you've been told that there's nothing more they can do at the hospital. Have you had any thoughts about what you want to happen or what you don't want to happen as things continue?
We've been talking about the heart stopping. You want the revival, say no, let me go. What's the point? And I hope I'm going to have a nice birthday down there. I'll be 77.
Will you be over there still, or will you be back here?
Of course I've got to be back here.
You'll be back here by then? Okay.
If you're still breathing.
That's it. And this is now fetal heart.
She's got an ear infection and lots of stuff is coming out.
You haven't done anything wrong, but I think that's just got infected. Ugh.
He doesn't want it.
No, he doesn't, does he?
Hold on, sweetie, hold on.
That's a good grip that you've got. Just trying to stimulate his gag reflex. It's not nice.
No.
So mean.
Sorry.
She's so mean. Well done. Over.
I'm Dr. Mackenzie. We spoke a few months ago.
Yeah. Now, when I last came in, I was pregnant, but unfortunately I had a miscarriage. No, that's okay. But I'm pregnant again, which is great. But obviously I'm really, really nervous. Every time I go to the toilet, I wipe and I'm scared I'm going to see blood. I'm just on tenterhooks all the time. And I was just wondering if I could book an early scan, if that's at all possible.
There's certainly not much point in having it done at 7 or before 7 weeks, because it can sometimes be inconclusive, surprisingly.
Yeah.
So you don't want any negative information. You want to either know that things are fine or not fine.
Yeah. And do the risks of miscarriage decrease quite significantly after 8 weeks?
Statistically, probably a fifth of all pregnancies are lost as early miscarriages. So about 1 in 5.
Okay.
So having had one miscarriage is, I'm afraid, not uncommon. So cross fingers, not going to happen again this time.
Yeah.
But even if it did, the advice would remain, well, okay, let's wait for a normal period. And then you try again. If this one happens the same as last time, well then, as I say, it's sad and upsetting.
Yeah.
But it's not the end of the road.
Yes. Yeah.
To try again is...
If I had one miscarriage, is it more likely I'll have another one, or is it completely...
Completely independent.
Yeah, okay.
All right.
Oh, gone. Can't be that bad.
Come in.
Hi,
have a seat. What can I do for you today?
I've just found out that I'm pregnant and I wanted to check in with the practice and go through whatever we need to go through.
Okay, is that good news?
Yeah, good news.
Congratulations.
Thank you very much. No, quite sudden. I hadn't come off the pill for very long, so I can't believe I'm pregnant this fast.
Okay. And was it something you were trying for?
Yeah. I came off the pill deliberately, so yeah.
You taking folic acid?
No.
No.
Okay.
I'd suggest taking folic acid and vitamin D.
Okay. The other thing that I have on my mind is that I was training for a marathon.
Yeah.
And that's due on Sunday. I'm concerned of running a distance like that in such early pregnancy would have I don't know.
Okay. I think because the risk of dehydration and things is quite high anyway. I know you're not far on.
Yeah.
I just wonder to be on the safe side, I'd say no. Is that all right? Sorry about that.
No, it's fine. I kind of was getting there myself, but it's...
Yeah. Okay.
Yeah, that's
I'm
fine.
sorry about that, though.
No, that's fine.
Because you'll have worked very hard.
I did. I spent the last 6 months training. Look, this in itself is
Are you desperate to do it?
I was. What's more important to you, your health, your baby's health, or running a marathon? In the grand scheme of things,
In the grand scheme of things, you can always enter next time.
Yeah, exactly.
Yeah.
So how are you anyway?
I'm okay.
Okay. So last time I saw you, we checked your blood pressure and it was a little bit high, and then you very kindly went on to do some blood tests, didn't you? Okay. You look nervous.
I'm so sorry.
Why?
I try to overcome it without anyone knowing that I am very nervous, you know.
What are you nervous about?
I don't know really.
We're just feeling a bit anxious.
Yes, I am. And I know it's partly me, and I'm trying to sort of... Thank you for listening to me.
That's all right. That's what we're here for.
Thank you very much.
And we talked last time about your late husband as well, didn't we?
Yes. It's a lot of sorrow within me at the minute, you know. Although it's 4 years ago, and we had a wonderful time and everything. You know, I think he was told he had 6 months to live, you see, and it was devastating because we didn't realise that he'd got anything, you know, so dramatically wrong. He had pancreatic cancer.
Right. Okay.
And we were both kind of numb. The sadness of losing a second husband. The first husband, he went to work and died. I didn't get to him. I walked into the room and I said, I'm so glad I've arrived in time. No. Massive heart attack in King College Hospital. And that was shutting everything off, dealing with the children, you know, the heartbreak and not being able to cry at all, really. No tears. I'm talking now because I probably need to feel that I can have a little bit of help here from you know, and overcome it.
It's obvious it still plays on your mind, and it can be therapeutic talking to somebody.
Yes.
I mean, what do you think about having some counselling? Because we've got great counsellors here, and they could talk to you about your loss. I think it would be really helpful.
Yes. You know, the sadness and the overwhelming sadness. I'm going to cry in a minute.
Oh.
Sorry. No.
You can.
Sorry.
I think as a GP, we do have a very privileged position in that we learn a lot about patients that probably even their closest family members and friends don't really know, because it's often easier to tell somebody totally removed from the situation about what's going on. And to see what some people have to deal with in their lives is quite incredible at times. And if I can actually be a part of helping them through those difficult situations and see them on the other side, then it's incredibly rewarding. This is for you to fill in before you go and give it to the girl on the desk. It's about the counselling, okay?
Yes, thank you so much. I really appreciate it.
No problem.
How do I appreciate everything? You're very kind.
All right.
I don't know how to thank you.
Oh, anytime. See you later.
Bye.
Cool, thank you very much. Have a nice evening.
And you.
All right. Thanks a lot. You're welcome.
Bye-bye. Oh, thank God. Oh, finished.
Hello, Brittany.